Good afternoon. This is Mayor Jerome Prince with your daily COVID-19 update. As everyone knows, we remain under Indiana Governor Eric Holcomb's 2-week or extended stay-at-home order at this point. City of Gary will continue to do everything to support such orders from the state and our federal governments. We are listening to medical professionals, and although the edict continues to change rapidly, their message is consistent that the order is to stay at home and travel if only necessary. We are soon going to roll out what we've put together, and we call it our special COVID-19 screening app for the City of Gary, and it will be on the webpage. I've actually taken a look at it, I've examined it, it seems to be working pretty well, but this particular app is another tool in the fight against the spread of the COVID-19 virus. We're in the process of finalizing this app now, and once it gets established, visitors will visit the website and be able to quickly and easily answer a few questions that would give you some idea of whether or not you need to seek further medical attention. It doesn't give you a definitive result, but the point of the particular app is to add yet another tool to help people discover any concerns that they may have, or at least give you a suggestion as to how to follow up and follow proper protocol. Many of our residents certainly do not have internet access. We ask that persons who view this message and who do have access to the internet or app or phone or what have you, please share this information and assist others that you know directly do not have access to the internet. Shortly, Dr. Roland Walker will share some specific updates about the numbers relative to state of Indiana, Lake County, and specifically Gary, Indiana. But clearly, as will be evidenced by his comments, we still have work to do to contain the virus. I remind you, please stay at home, only travel when absolutely necessary. Make sure you share all the information that you receive with your loved ones and those who are certainly susceptible and vulnerable to the spread of this particular disease. Unfortunately, I have to ask that we stay off of the basketball courts and playgrounds and things of that nature that have been identified as sources or hotspots that can help spread the COVID-19 virus. Most of all, we just want to encourage everyone to continue to practice safe, sound behavior. Shortly, I'm going to bring Dr. Walker up, but as you could see, here at City Hall and across the city, all city employees are certainly adhering to the order, practicing social distancing, and continuing to wear the personal protective equipment that we place and have for them in an effort to keep them safe as well. So we encourage you, in addition to your family members, to continue to practice safe habits. Shortly, you will hear from Dr. Walker. Thank you.
And good afternoon, citizens of Gary. Once again, I want to thank you for allowing me to come into your household and share a little bit of information about this corona pandemic. On a personal note, I just want to thank all the people for the well wishes, particularly for the health of my mother. It's greatly appreciated. So the new numbers came in today for the city, for the state. And as you will see, as it's brought up, and of course, electronics always is difficult, we've had a total of 436 deaths in the state of Indiana. And so Lake County is just approximately under 10% of that. And we've had a total positive of 8,955 positives in the state of Indiana. And once again, if you look, Lake County is right about at 10%. I bring that up just to let you know that Lake County is quite significant in the amount of positives that we've had. Now, Lake County is 876 positives and 33 deaths. And then very specific to Gary, Indiana, I want to let you know that Gary, Indiana currently has 193 positive patients and 5 deaths. And also, like I've mentioned before, we're trying to pay special attention to Porter County as well. And Porter County has 130 positives and 2 deaths. So I bring that up for a couple of reasons. One is because testing is very, very important. Currently in Gary, Indiana, at St. Timothy Community Church, we have a drive-up test center, and that's for first responders. So that would be police, fire, EMS, all hospital or healthcare workers, so if you work in a doctor's office, and all essential personnel. So anybody that is currently working would be considered essential personnel. You're exposed to the public, and we encourage you to go get tested because testing lets us know what the numbers are and also helps us get resources. So we find that to be very important. Going forward, I want to talk about symptoms because what we've been thinking about in terms of COVID is we've been thinking about respiratory, and it's a respiratory spread, but I also want to let you know there's been some other symptoms that we've been noticing, particularly in senior citizens. So we're seeing neurological symptoms, so possible seizures, stroke-like symptoms. People with kidney disease in particular need to be careful because we're seeing renal disease, we're also seeing liver disease. And I bring that up because these are the important comorbidities that we want to make sure we address, particularly in our community. And so we are working very hard to make sure that we get extra help for our community, perhaps in the form of a field hospital, perhaps in the form of some type of widespread screening. And so the mayor and I and his entire team are working very hard to make sure that comes to fruition for Gary. Also, the mayor mentioned the screening tool, and I worked and I actually tried out myself in different scenarios for the screening tool that will be on the Gary website, and I think you'll find that to be very helpful. I think it'll give you more tools as well. For instance, if you go to the emergency room and you are suspecting that something's going wrong and you think that it's related to COVID, that'll give you the tools to be able to speak to professionals in a manner that'll make you feel comfortable. Because one of the things that I mentioned when talking to community leaders around Lake County and District 1 is that sometimes our patients, our citizens, are uncomfortable going to healthcare professionals because they feel like they're not being heard. I want to let you know from a personal standpoint, I hear you, the mayor hears you, and we want to address those issues because we want everybody to feel comfortable with their health care needs. And that'll be it for me, and Mayor, thank you very much.
Thank you. So finally, in closing, I just want to point out that as Dr. Walker clearly articulated, we're doing everything that we could possibly think of to address the COVID virus, to certainly share information about discontinuing of the spread. But as you can tell, conversation sort of gravitated to what to do if you receive a positive diagnosis, and we believe that that is equally important in sharing accurate information and to quell any alarm that may exist in the community. Finally, I also want to continue to encourage our state and federal leaders to continue every effort possible to send us the necessary resources, as statistics would suggest and dictate that persons in African American communities are more likely to be impacted negatively by the spread of the COVID and potentially even succumbing to death. We've had a great relationship up to this point, and we have no reason to believe that that won't continue, and we certainly are going to continue to make the push for additional resources right here in the community. I want to thank you again for all the attention that you've given on a personal level. I want to also thank you for sharing this information with the citizens and family and friends that you have, but most of all, I want to thank you for adhering to the edict of staying your distance, practicing safe and social interactions with people, and stay patient. I believe that very soon we will get through this together. Thank you.